For the record, good morning, everybody. How are you? For the record, my name is John Fitzgerald, District 3 City Councilor, and I'm Chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. Today is July 31st, 2025, and the exact time is 10:07. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. Written comments may be sent to the committee email at ccc.health@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of this hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you are interested in testifying in person, please add your name to the sign-up sheet near the entrance of the chamber. If you are looking to testify virtually, please email our Central Staff Liaison, Megan Kavanaugh, at Megan, MEGHAN, Kavanaugh, KAVANAGH, at boston.gov for the link, and your name will be added to the list. Today's hearing is on docket number 1372, order for a hearing regarding the modernization of the Boston EMS dispatch phone system. This matter was sponsored by Councilors Erin Murphy, John Fitzgerald, and Ed Flynn, and was referred to the committee on July 9th, 2025. Today I am joined by my colleagues in order of arrival. We have Councilor Ed Flynn, Councilor Erin Murphy, and that is it at the moment. I'll now turn it over to opening remarks, starting with Councilor Ed Flynn.
Thank you, Mr. Chair. Thank you, Councilor Fitzgerald, Councilor Murphy, for holding this important hearing with Boston EMS, the Boston Public Health Commission, emergency communication experts for being here as well. I look forward to today's important discussion. Our 911 Dispatch Operations Center is staffed by professionals who are specifically trained and skilled and provide life-saving instructions to callers. They help with assessing patient conditions. They provide calm during tense and stressful situations. They're overworked. They're underpaid. We had the EMS team, EMTs, come by recently to perform CPR and Narcan training for City Council staff 2 weeks ago, and my staff, who had no previous experience with CPR training, noted the professionalism and expertise of this EMTs in their clear instructions on how to save a life. They are hardworking, skilled, and they care about the work. They care about the residents of Boston. It is critical that we discuss how we modernize our EMS dispatch phone system, which is now outdated. We need to equip our EMTs with equipment that is efficient, meets the needs of our time, so that we can maximize response time and minimize inefficiencies and delays. And I am discouraged because I know how response time, in my opinion, has gone up. EMT work is critical and life-saving, and we need to recognize their work. We need to pay them a fair wage, a living wage, make investments in upgrading EMS technology and infrastructure so that they continue to operate effectively and save lives of Boston residents and visitors alike. Thank you, Mr. Chair.
Thank you, Councilor Flynn. Councilor Murphy.
Thank you. Good morning, everyone. Thank you to my colleagues, Councilor Flynn and Councilor Fitzgerald, for co-sponsoring this important discussion, this hearing with me. But first, I do want to start by saying thank you. My family did need to call 911 the other day, and unfortunately, it did take 13 minutes for an ambulance to dispatch and another 10 minutes for it to arrive. But my 91-year-old dad, for a second time in the last few weeks, tripped on the sidewalk right outside his home, uneven patch in the sidewalk, and fell hard. And at 91, anytime you fall, it is a dangerous situation, a scary situation. But I do just want to thank the professional team that did show up. They were, obviously very supportive, professional, and helped Papa Jack and my family through that unfortunate time the other day. So I do just want to say thank you for that. Just a few weeks ago also, my team and I have many summer interns joined a walkthrough of the city's dispatch operations center, where I was fortunate to tour with them the 911 police side, staffed by SEIU, local 888 dispatchers, and the EMS call-taking side. What I saw confirmed what many EMS professionals have been telling us for years. Our EMS dispatchers are performing high-stakes, life-saving clinical work on an outdated system that does not match the urgency of their responsibilities. Boston EMS call takers are certified EMTs. They are real first responders. Over the phone, they guide residents through CPR, help deliver babies, talk someone through clearing an airway, all while remaining calm and professional under pressure. But unfortunately, they are doing all of this on outdated technology and at a lower pay scale than their counterparts in the police and fire side. That should concern every one of us. This hearing is not just about modernizing a phone system. It's about ensuring that every Bostonian, whether they're calling from Mattapan, the Back Bay, or East Boston, receives timely, high-quality emergency care when they call 911. It's about equity, safety, and respect for the professionals who answer that call. Today, I'm glad that we're going to hear directly from EMS leadership and the Public Health Commission. For me, the goal is to understand where the system is falling short, what it will take to bring it up to the 21st century standards, and how we as a city can make this investment a priority. So thank you, and I look forward to this discussion, and I'll have questions after your presentation. So thank you for being here.
Thank you, Councilor Murphy. And I know that there is a slideshow that's from the union side. That's great. So I think what we'll do is we will start at the union side in the presentation, and then hopefully hear what is being done on the administration side from the superintendent and how it's resulting in those, and we can find out where the gaps are, if any, right? Okay. So please, I turn it over to you guys. Please introduce yourself and carry on with the presentation.
My name is Jason Yekins. I'm a Boston paramedic and the union president for the BBPA EMS division.
My name is Miles Royal, union legislative director for the BBPA EMS.
And before I want to start, I just want to say, Councilor Murphy, I will pass along your kind words to those members that came to your loved one, and I'm glad that they were very professional and did what they needed to do for your loved one. So that's very great to hear. Good morning, City Council. Thank you for this opportunity to speak today. Like I said, my name is Jason Yekins, Boston paramedic for the last 18 years and president of the BBPA EMS division, representing over 400 EMTs and paramedics. And I'm honored to represent the hardworking men and women up at Dispatch Operations who are qualified Boston EMS field EMTs and trained as emergency medical communications operators, thus serving as the vital first link in Boston's emergency medical response. Today's hearing addresses an issue that is long overdue for both attention and action. This antiquated, unreliable, improperly installed phone system EMS is required to use, and the outdated Central Medical Emergency Directions System known as CMED, and the broader implications that this system failure has on public safety, responder morale, and equitable treatment for our city's first responders. Additionally, this information pertains to the communication systems the city is responsible for and not the Massachusetts state-owned terminals, as they are updated and properly maintained by the state of Massachusetts. Let me begin with the most pressing concern. When a member of the public is in a medical emergency, they expect immediate help. In Boston, EMS operators are more than just call takers and dispatchers. They are clinically trained Boston EMS EMTs providing life-saving guidance over the phone. They include CPR instructions, childbirth coaching, bleeding control, airway management, often well before an ambulance arrives to the scene. But they are doing this work on a phone system that is out of date, less reliable, and less capable than the system used by colleagues at the police and fire dispatch centers. When the system drops a call, misroutes them, or fails to connect reliably, it puts lives at risk. And it places our EMTs and supervisors in an impossible position of having to perform under conditions they cannot control. The tools fall far short of life-saving standards we thrive for in the 21st century. When 911 calls are dropped, misrouted, delayed because of system failures, it impacts lives. The difference between properly routed calls and the ones mishandled can be the difference between life and death. We're talking about real people, our neighbors, your constituents, experiencing heart attacks, strokes, car accidents, or suffering from a heinous crime. To be clear, this is not just a technological issue. It's a matter of equity and respect for the critical role that our EMS plays in public safety, and I thank the councilors Fitzgerald, Murphy, and Flynn for recognizing this issue. Police dispatchers recently received a long overdue wage adjustment to reflect the seriousness of their work. We applaud that progress. But our EMS dispatchers performing equally critical calls combined with medical guidance on clinically complex cases remained underpaid and undervalued. These wage disparities of over $25,000 a year, combined with inferior technology, sends a clear message that EMS is somehow less vital, it is less deserving, and it is less important. That message is demoralizing. It undermines morale and retention at a time when our city can't afford to lose trained, experienced emergency professionals. We are already seeing the consequences today. Morale is low. Our EMTs are doing the best, but many are burning out. They are tired of feeling forgotten, expected to perform at the highest level without the tools, the pay, or recognition given to other first responders. These professionals who are chosen a difficult career because they care deeply about helping their neighbors. When a flawed 911 communication center or CMED system forces them to operate with delays, bad information, missing calls entirely, it takes a toll, a human toll at all clinical levels. The feel of guilt, powerless, and emotionally fatigued. This unreliable system forces us to find workarounds, calling on cell phones, logging data manually, or verifying locations by other means. This constant interruption erodes the operational flow, increases stress, especially during peak times, and it sends a message that the BPHC expects us to make it work regardless of the flaws. Thus, frustration spills to all divisions within Boston EMS. Blame circulates, morale deteriorates, confidence in leadership erodes, and a toxic work environment thrives. When morale is low, retention suffers, and when EMS professionals leave because they don't feel supported, it affects service levels across the board. We often feel that our leadership, the Boston Public Health Commission, and the city do not prioritize our needs, our safety, and this is one of many examples. However, it isn't just a staffing issue today. It's an operational readiness issue. Every time a call is delayed, dropped, mishandled due to system failure, the chain of survival breaks down. And that failure is not hypothetical. It is measurable, it is preventable, and it is urgent. The solution is clear. Modernize the EMS phone system, CMED operations properly and swiftly to ensure our members can do their job efficiently, accurately, and safely. This is a basic standard for emergency medical operations. Boston should lead by example, but unfortunately, we're lagging behind it. Demanding proper installation of the phone system on the EMS side of 911 is imperative, and it acknowledges that every second in an emergency matters, and that every responder deserves the proper tools to save lives across this city. So today I'm asking for your support, not just in words, but in actual actions. The proper installation and maintenance of our communication system isn't a technological issue, it's a public safety issue, it's a staffing issue, and frankly, it's a moral obligation. We need a system that works reliable every time without fail, even on June 18th, 2024, because that's what the public expects, and that's what our responders deserve. Let's invest in a communication infrastructure that honors the trust this community has placed in us. Let's make sure that when someone is having a medical crisis, help gets there without error, without delay, with the full confidence in the system backing it up. No more excuses. Police and fire has already updated their system years ago, and we still have not. Thank you for your time.
You can show the next slide. As you see here, if you go up to one of our dispatch center, you'll see 2 lieutenant terminals that are up there on the platform. You'll see 1 clerk terminal that's on that platform. You have 6 911 call taker terminals that are just below the platform. Those are currently owned by the state. 4 dispatch terminals, which are off to the left side, and 2 Boston CMED terminals, which are off to the right. This is just a quick overview of what's actually up there. Next slide. So phones are connecting to this primary system where it's very outdated. If you see, these phones are very old. They're coming in through analog channels, which is this gray wire here, where a modern system is through voice over internet protocol. This does not have that. If you were to pick up this phone, answer it, there's no way for this phone to be transferred to another call taker, another 911 dispatcher. So everything would have to be answered through this phone. Next slide. You can see that these phones have certain instructions that have been written on them on how to be used. So that first phone that you saw is then going to be transferred into this phone, and then it would go into a second system, which would be on this right, that phone that is very off to the side here, but will be seen in the next slide. These buttons would light up with whichever phone call could be coming in, and this phone is another outdated system which would have those transfers. Next slide. So coming in on these two left phones, those are the phones that would be coming in. It would be coming in through those two phones, in through the middle terminal, and then it would be coming out to these new internet VoIP phone calls, which can be transferred. So this has been a temporary fix on how to get that done. But how it's been done is we should be able to get rid of the two phones on the left, the phone in the middle, and just be able to go off of these VoIP phone systems here. Next slide. New phones that were not installed properly for Boston EMS IT department. These phones are a workaround and provide operations with limited advancing features. Placing calls on hold, transferring calls, avoid dropping calls, caller ID, being able to screen phone numbers that are coming in. They've been piggybacked one after the next to make these phone systems work. There's been a slight delay in transfers on any of these phones, and there are phone calls that have been dropped. Call forwarding systems on these phones, if a phone call is terminated between the dispatcher and the 911 caller, there's always that callback number. But if I were to call from dispatch back to that caller, they're getting phantom phone numbers, so it could be a random 10-digit phone number that they're calling back on. They don't know who's calling. It's not showing up as 911 is calling you back. It's not showing up as Boston EMS 911 onto your phone. You don't know who's calling you back. That's something that certainly needs to be done so that the dispatcher, the call taker, whoever needs to, can reach back out to that caller. Next slide. There's a video here for you. So,
There you go.
came in through the first phone, very old phone system. You can hear the old ring. Came in through that one to then be transferred into the second terminal. That's certainly something that needs to be updated to be, not go through one system into the next system, going from there. So here again, other terminals, you can see how it's going back from piggyback to piggyback onto a new system. Next slide. These are the police side where they just have the one terminal. So just having that one terminal is certainly much easier in a speed up process. Next slide. This is one of the CMed terminals. It's outdated. It's unable to get physical equipment update. There's no more ring down options. Ring down meaning pick up the line, press a button, and you can talk directly to Boston Medical Center, Brigham and Women's Hospital. You'll get directly to the nurse system that's right there. Your EMTs, paramedics that are in the back of the hospital, or back in the ambulance wanting to call the hospital, they can say to the CMed operator, hey, I need a ring down for security. This is a much quicker way of getting the help that you need there. This has been an ineffective method of communication between ambulance and EMS operations, and it certainly needs a way of being sped up instead of the way it's been going on now. This is another terminal that's there. It shows, next slide, this on the right here. You can see if it's You have all these different towns that are able to come in just through Boston here. All the ambulance for EMTs and paramedics all throughout the region call directly into CMed. This is how they would come in. This is still an older system, but to have a better system and operate better would be much appreciated. And I believe that would be it for the slideshow. Thank you.
Thank you very much.
I just want to make it clear, though, when people call operations, it's not through the 911 that directly connects to one of our call takers. It's when it goes to a primary line, police or fire, and then gets transferred over. Like I said, the state-owned ones are maintained and updated by the state, but they don't always route through that.
Understood. Appreciate that presentation. I would also like to acknowledge that we have been joined by Councilor Braden, and if no one saw him come in earlier, Councilor Weber. No one, yeah, who snuck in quietly. Yeah. Thank you both for showing up. We also have letters of absence from Councilor Pepin and Councilor Santana, who apologize for not being able to make it today. Thank you again for that presentation. I think we'll turn it over to Superintendent, if you don't mind, and you can go ahead. Thank you.
Good morning, everyone. Thank you for allowing me this opportunity to speak today. My name is Lee Alexander. I'm a superintendent at Boston EMS. I oversee the training, recruiting, and community initiatives department. Thank you for the shout out. We were here last week teaching CPR, so that was part of my team. Councilor Murphy, I hope your dad is mending well. So moving on, before I provide my statement, I would like to let my colleague Elliot Durdak introduce himself.
Absolutely.
Good morning, councilors and other attendees. My name is Elliot Durdak, and I am the Boston EMS Communications Systems Engineer. I've been employed for over 36 years by Boston EMS. I'm responsible for the voice two-way radio systems, which includes those used by Boston EMS exclusively, as well as what's been referred to as the CMed, or Central Medical Emergency Direction Network, that services 61 cities and towns. I'm also responsible for the Verizon administrative telephone system. And again, thank you for inviting me.
Thank you.
So I would like to take a few minutes. I would like to take a few minutes to provide some background on our communication systems at Boston EMS and our dispatch center. There are multiple modes of communication, some of which are managed by us and others that are not. First, there is the 911 call handling system, as the BPPA has mentioned. This is the line that connects residents experiencing a medical emergency to our EMT certified call takers. This system is managed, maintained, and paid for by the state 911 department. It is the same Motorola next generation 911 call handling solution used across the state of Massachusetts and across all three public safety services: Boston Police, Boston Fire, Boston EMS. Next, we have our CAD system, or computer-aided dispatch, which is the application used to share information between our call takers who enter relevant incident details into the system. Our dispatchers then take those calls and send them to our ambulances to calls, and then our responders respond to those calls. This system is the same for all three public safety departments: Boston Police, Boston Fire, and Boston EMS again. By having a single shared system across our three public safety services, we can respond jointly and ensure a coordinated response when needed. Third, we have our radio communication system, which is a vital component of our work, connecting members of dispatch, operations, and crews across the city. We're grateful to the city for investing over $20 million in upgrading our radio infrastructure. We are currently in the second phase of this three-phase investment, which includes more reliable and expanded coverage throughout the city, with many of the upgrades already realized. This project is being done in coordination with the Boston Police Department and their Blue Radio project. Then we have our CMed system, or Central Medical Emergency Dispatch, which allows us to connect ambulance crews, not only our units, but private sectors and across Massachusetts, throughout, or some of Massachusetts, throughout Boston and 60 other cities and towns to support medical control and provide advance notice to clinical teams prior to receipt of critical patients. This system is currently in the final stages of an upgrade paid for by the Region 4 Metropolitan Boston EMS Council. Lastly, we have our more traditional administrative telephones. Similar to what many of us have on our desks, these are completely separate from our 911 phone system. These administrative phones are principally used for interdepartmental communication, such as contacting personnel for scheduling matters. They include features such as caller ID, call hold, call transfer, multi-line handling, and call recording. If I wanted to reach a supervisor at our dispatch center, I would call one of these telephones. About a year ago, Verizon discontinued the digital phones we were using. We have implemented a stopgap solution that included essential features and are in active coordination with Verizon. The updated phones are expected to be rolled out this September. Neither our operations nor our ability to provide care to residents are impacted by the current state of these telephones. Thank you.
Thank you, Superintendent. I'm not sure if Elliot has any further presentation, or is he just here for questions and answers?
More on the technical side.
Yep, okay, great. Thank you. Jason Miles, thank you for your presentation. Superintendent, thank you for that. I will now turn it over to questionings in the order of arrival, and we'll start with Councilor Flynn. Councilor Flynn, you have the floor.
Thank you, Mr. Chair. Thank you to the panel that is here that provided excellent testimony. Jason, I just want to ask you, the June 18th, 2024 date that you referenced, that was when basically the power throughout the city shut down, including anyone that wanted to call into emergency operations throughout the city. Is that correct?
Yeah, I think it was a statewide shutdown for the 911 system. As a result, the terminals that the state owns, even though they're very reliable and usually don't have problems, they were shut down across the state. As a result, all numbers, all emergencies had to be brought through the phone lines that Superintendent Lee said. As a result, we were under those old phones at that time, meaning there was only one line that every single emergency had to go through. And unfortunately, that phone has no ability to place patient calls on hold or transfer them. So there was a huge slowdown, resulting in the overflow going to the police and fire side, who had an updated system and could handle that.
Thank you. Because of that, were ambulances delayed reaching patients?
I wouldn't have that information, unfortunately. I would have to go to Superintendent Lee to see,
Okay.
to find that data.
Superintendent, during that day, were there delays of ambulances getting to patients in need?
I also don't have that data in front of me, so I'd have to follow up.
Okay. Well, let me ask Councilor Murphy. Maybe Councilor Murphy can help me. I wanted to ask Councilor Murphy through the chair. Councilor Murphy, when a loved one from your family was injured, can you tell me the response time from EMS? I just want to make sure I hear that correctly.
23 minutes.
Thank you. So, Superintendent, 23 minutes for a response from EMS, who everyone knows I have great respect for the professionalism, but 23 minutes getting to an elderly person in need of critical medical services, is that a breakdown in the system?
I don't have all the details of that and what other calls were going on that day, so I'd have to look it up and see what other calls were pending.
But for an older person, I think, Councilor Murphy, your loved one is in his 80s, 91. But for an older gentleman in his 90s that's bleeding, that would have to be the highest priority, wouldn't it?
Although I understand the angst, I guess, in waiting 23 minutes, Again, I can't answer without knowing what other priority calls, cardiac arrest, respiratory, those sort of calls, they're triaged. So I don't know what calls were pending at the time that would cause a delay.
Okay. I am concerned about certainly that issue, but I don't know, is that an isolated incident, or do patients in need frequently are on the ground until an ambulance comes? Are we talking 10 minutes, 15 minutes, 20 minutes, or are we talking, 2 minutes, 3 minutes, 4 minutes, 5 minutes? What is our general, what's the general response time?
We aim for a response of under 8 minutes, but again, I don't know what the situation was at that particular time, so I can't answer that.
Okay, so you aim for 8 minutes, but what is the response time for EMS to get to a patient?
I don't have that information, apologies.
Okay, do you guys have that information?
Our goal is 7 to 8 minutes on the typical priority 1, 2, and 3s. There are times when, during peak times, the call volume is higher than the number of available ambulances. So there are times when our professionals cannot get to the scene in an appropriate time that the union would say. So I wouldn't say that it's unheard of, but it's unfortunate that an elderly male had to wait that long, not given that it was the information that I have received did not go through the proper channels at EMS dispatch operations.
Okay. I still want to focus on the response time. I'm not convinced that we are meeting the 7 to 8 minute recommendation or requirement. That's a major concern to me, because an elderly person that may have a heart attack, every 30 seconds is critical. Every minute is critical. But so I guess through the chair, could I get the response times for EMS picking patients up, what the response time is, and have there been any issues or cases over the last couple of years, over the last 3 years, where it took EMS longer than 10 minutes to get to a patient? Could I request that through you, Mr. Chair?
Absolutely, sir.
Thank you. I have to do my due diligence, and I take these issues very seriously, and I just can't accept that our EMS team, and again, I have tremendous respect for them, it's the overall operation that has forced these wonderful and dedicated professionals into a situation where they're overworked, and we don't have enough of them. Let me ask one final question, Superintendent. I often see, I hear about a call out that there are no ambulances in the city for a period of time. Sometimes it's like on a Friday or Saturday from 6 o'clock in the afternoon. But what does that mean? There are no ambulances available to pick up a patient. Is that accurate, that there are no ambulances to pick up a patient, that all ambulances are being utilized?
There are times when all of our units are busy. We do have a system in place where we rely on our private counterparts to pick up calls, but I can't speak on particular days or times. I don't have that information.
And where would these private companies be coming from? Are they coming from Boston, or are they coming from the suburbs?
Typically, they'll offer up on our BAMA network, and they'll give us an ETA to the address that we've given.
So we could have an ambulance coming from Stoughton going into Dorchester, or is that?
Not necessarily.
But give me an example where they could be coming from.
I wouldn't know where they're coming from. They give us a time. So they say we have a 4-minute ETA to that call, a 5-minute ETA to that call.
Okay. Jason, are you familiar with where these ambulances come from?
Like the superintendent said, they are mostly privates. However, they do come from the surrounding towns. We have seen Brookline or Revere, Chelsea going into the city of Boston to help us under mutual aid agreements in order to fulfill the 911 call volume. There's many times where we don't have enough ambulances to service all the 911 calls being flooded in.
Okay. Thank you, Mr. Chair. I'm going to stop there. I do have further questions, but out of respect for my colleagues, I want to give them an opportunity to ask questions. Thank you, Mr. Chair.
Thank you, Council Flynn. Council Murphy?
Thank you. Thank you, both sides here, for your presentations. Question on, and thank you for uplifting, and I was reminded again, even though I knew this, but the call takers that take the 911 calls that get sent over to the EMS side, they are EMTs, right? And I don't think many people realize that, so I do have a question about the pay disparity. First, I do want to uplift Tom McKeever, SEIU, in the hard work that they put in, because myself was advocating to make sure that our 911 dispatchers were getting paid what they deserve, and that there was much needed changes in their scheduling and their work, environment. And I think many people made an assumption that that also meant that it meant the other side, there's that wall there and the EMTs are on the opposite side, that would mean everyone was getting that same upgrade to their work, pay, environment, retirement. And we just had a hearing just the other day to even advocate that our 911 dispatchers are put into a different grade, that they're paid as first responders also. That being said, does that mean that all of our EMTs get paid around $25,000 less than our 911 call takers? It does, right? Yes. Okay. So I think that just needs to set in a little, that the brave men and women who are out there in our ambulances trying to get through traffic and, get to emergencies. And I've been on ride-alongs, and I have obviously the utmost respect for our firefighters and our police, but I've said this to them also, that the EMTs, I believe, many times work the hardest. They're the last ones, right? Many times, they're carrying people out, and it's that personal connection too. When I was on a ride-along, I saw on 3 different calls, the woman needed to leave the house, she needed to gather her belongings, right? So just the respect that you give to our residents across the city, the phone calls, who's going to take care of the dog? Can you call my daughter? Will you lock the door? Will you make sure I shut my lights off? I have to go to the hospital. So, or it's the calls where they're unconscious and you need, life-saving support right away. But that we're paying our EMTs $25,000 on average less than our 911 call takers. And I believe that our 911 call takers deserve the pay they get, but we really have to take a deeper look at how we fix that problem. To me, that's a problem. And I understand that fire and police are under our city budget, right? And that EMTs are under Boston Public Health, so they do come from different pools of money, but at the end of the day, when you call 911, no one cares or understands, and they shouldn't, who's paying who, right? That shouldn't be ever be on the mind of any Boston resident when they pick up the call, that this phone system is not as adequate because it's under the Boston Public Health, but this phone system is better. Like, that just also to me is unacceptable. So I do think we have to look at what are the next steps to make sure that we make that even across the board. And to me, this is just the beginning, right? And I know there is a space between us all, but I know that at the end of the day here, and I'm not saying we don't already do that, but the union, us on the council, the mayor's office, and the leadership at EMS has to come together to really, because at the end of the day, it's the respect of our city workers. Our EMTs are our city workers, and it's getting to the patients, right? When you call 911, every second feels like 10 minutes, so 23 minutes seems like a long time. And in this case, and I do know that we're going to follow up, but I'm pretty sure that the closest ambulance, there wasn't an ambulance in the area, so the closest area that was going to come to Dorchester was out near the Jamaica Way, so that alone was going to take a long time. And I know that there used to be a database, and if you could talk to this, where they shared if there were areas that didn't have, you know, an ambulance nearby for a certain amount of time. Do we still share that data? Is that publicly shared when there may be a neighborhood in the city for a period of time, for whatever reason, is down an ambulance?
If there's ambulances available, they will relocate them to a more central location in order to decrease the potential for a delayed response. But given the call volume and the number of ambulances, it's not always feasible.
And thank you for the like the pictures even showing, like I was physically there, but that we've kind of put together these phones with cords. Like, what would you say if we couldn't do it all at once? Are there certain things that we should do right away to upgrade the phone systems? When you mentioned how we're not able to like put someone on hold, connect to maybe the nurse in the emergency room, you know, the person, you know, on the ambulance isn't able to communicate. Sometimes they're pulling out their cell phone because they can't put calls on hold. Like, what would you consider, if you were to rank order, what would be the most important parts of the system you would fix first?
Probably the primary phone lines that go into dispatch operations. They're used more than just employees calling up to talk to lieutenants. Those phones are utilized for multiple different reasons, from transfers to hospitals to correctional locations. Everybody that knows that number will call the particular number that goes to dispatch operations. So modernizing that and getting that to the highest priority would be, I would say, is the most important, and it would actually help alleviate some of the stress and anxiety and whatnot that our supervisors and clerks have to deal with, trying to navigate that phone system and being able to get help where it needs to be, followed probably by CMED. I've been told I've never worked up in dispatch operations. However, I've been talking to many of the individuals up there, and it sounds like CMED is out of date. There's a new system up there, but it was put up there probably before COVID and never turned on. There's a question of that the equipment has never actually been acquired by Boston EMS, that it is still at maybe the middleman or the distribution center, that we don't actually have it. So I think having a reliable CMED terminal also would help our field individuals, not just in Boston, but across this region, because it's also a safety. We use CMED for potential patients that may cause harm upon us, as one of our EMTs did have to suffer many years ago. Having those ring downs is important. Right now how the system works is if an ambulance needs help, in the request of a ring down asking for security to be available, say at the Mass General, they say it on our frequency, and then it is screamed across dispatch operations to the CMED terminal, like Miles said, dispatch is on the left, CMED's on the right, and then that individual, if they're capable of doing it, will be able to then call. Back before, there was a way where you could just push on a switchboard and get immediate response from the hospital. So there's multiple levels that needs to be rectified. I do want to acknowledge what you said about EMTs. Our EMTs do more than just saving lives, going in and helping people. They go there, they talk to elderly people when they're lonely. They help people get their belongings, their support for family members. And we do acknowledge the great work that the Boston Police dispatchers and call takers do, but our EMTs are out risking their lives, risking getting injured, suffering life-ending career injuries, and they're significantly underpaid. They work very hard every day. They keep up to date with the newest advances in medicine and pre-hospital care, as well as cross-trained in other divisions within Boston EMS, and they're not valued or what they should be. So thank you for acknowledging that.
Thank you. I have more questions for the next round, but thank you.
Absolutely. Thank you, Councilor Murphy. Councilor Braden, you have the floor.
Thank you. Good morning, everyone. Thank you for being here. Sorry I was a little late. I had to go to a fire incident, so here we are. Another reason why EMTs are so important. Can you tell me, maybe get us up to speed on, I know there was going to be a new regional plan, service zone plan. Is that being completed? And I know we had to factor in, I don't know the status of the Carney, but I know we were sort of waiting for that last year. Did the regional plan get, the service zone plan get updated? modernized?
I don't have that information. I would have to go to the department. I know you asked that during the hearing I was at, as well as the vital statistics that would have response times on.
Yeah.
I don't personally have that information.
Yeah, I think every time we have an EMS hearing, those are the questions I want the answers to. The other thing is really response times to, like say from advanced life support ambulance to go to, from Beth Israel to Oak Square. What's the time? Like, I think it's at least 15 minutes, but I don't know what happens when you put the lights on and really hit it. But at traffic time, I can't imagine getting getting there. Certainly, you're not getting there in 8 minutes. So I'd really like some real-time figures on how long it takes to get advanced life support from Beth Israel out to sort of the edge of our district out in Oak Square or somewhere like that. One question I'd love to just clarify is, I know that BPHC is a quasi-public entity that is not sort of under the direct, it's not a city department. How, in terms of getting new funding, like capital investment in a new communication system for EMS, what's the process for? Like, I'm imagining it's state money. You have to go to the state and get money for it. Like, I'm really not well informed about how to get capital investment in this system, and then also how much it would take to bring it up to speed. Because I think, you know, this system, the CMED system, as you say, they invested in that, but it's never really been fully operationalized. So that seems like a wasted money. But any thoughts on that, or any?
I'm going to have to defer that to Superintendent Lee, because on the union aspects, we don't have that information. We can't acquire that information, but that would have to be something from the departments.
And I would just have to follow up with, I'll have to follow up on that because I'm not privy to the financing side of things and how the grants and funding is acquired. I can speak to the service zone plan, which has I guess the old plan was updated in 2016. We're just waiting for official sign off on that.
Yeah. Well, see, our problem in Oak Square is, or in Alston Brighton, our population has probably increased by 5,000 or 6,000 in that time. So 2016 figures are almost 10 years old at this time. So it seems a little antiquated. I'm sure I'm not the only district. Councillor Flynn's district's grown immensely. So, you know, how do we calibrate the service zone plan to recognise our growing, you know, increased population across the city, and especially in the more far-flung, like East Boston and Alston Brighton, are sort of more remote areas of the city that are a little more problematic in terms of, because we're not sort of in the central zone. Is there or do you know anything about, you know, how those numbers kept up to speed, up to date?
I'm not aware of the numbers. I'd have to follow up with you.
Okay. Because I really would like good numbers so that we can sort of follow up again and work and advocate strongly to get more resources for you all. Response times, and then the cost of the system. Just, I know that when we need a new EMS station, we sort of go cap in hand and try and get community benefits from developers and whatever to build us new EMS stations. It's not really the way to run a public service, to sort of have to go cap in hand. And we had a commitment from Stewart Healthcare to build a 2-bay EMS station over when they built a new garage at St. Elizabeth's Hospital, but I can't see that happening anytime soon. So it's sort of, I feel bad for EMS because they're sort of the orphan child that have to find ways to get more value out of what resources you have, and you know, we shouldn't have to go and have to sort of find all these workarounds to try and address emergency, a vital emergency system that we need.
I agree to that statement. We always try to find whatever scraps we can find. Like I said earlier with Councillor Murphy, our individuals work very hard, and whatever funding that we can find or grant money to put up an EMS station or update equipment, it is severely underfunded. We still have ambulances to this day, decades after being implemented into the system, that still sit on street corners. They don't have a station to go to, they don't have a bathroom, somewhere to sit, somewhere to eat their lunch or dinner. And sometimes they're sitting in there for 16 hours because they've been mandated because we don't have enough personnel to fund, put up the required number of ambulances. With response times, I work that ambulance that you're referring to, and I have property in Brighton. The response time is delayed. It is very long. Going from Beth Israel to Oak Square, where I am, it is a long response time. So I'm glad you're asking those questions because I'm curious as well.
Yeah.
So.
My problem is I've been asking the questions for a long time and haven't really gotten, I haven't gotten satisfactory answers. So we need to actually be in full court press to try and get more resources for EMS. And you shouldn't have to go cap in hand to try and get
I think most of our
very basic funding to deliver service for all of our districts across the city.
Correct. Most of our funding comes from payables. We always joke that we're the cheapest public service in the city, that most of our funding comes from billables. Police and fire, they do a great job, and we thank them, and they're our counterparts, and they help us, but their budgets are significantly higher than Boston EMS's, even going personnel to personnel. We would love to see more funding allocated to Boston EMS and to increase our staffing levels, our ways of delivering life-saving measures, progressing the department, and that needs support from everyone.
And I think the issue is really getting into the weeds on capital investment in EMS, and not just for your vital communication system is critically important, but as you say, you have ambulances sitting out on street corners in weather like yesterday, running their engines all day to try and keep their medical supplies at an optimal temperature and then keep you folks safe as well.
Correct.
It's not the best way to run an ambulance system. I'm sure I'm out of time. Am I out of time? I'm sure I am.
One more question.
One more question.
I know you got one.
So what would you advise in terms of our advocacy? Like we're sitting with all the folks that advocate very strongly for EMS. Is it a state issue? Is it goes beyond just what we can do at the city level?
I think it's more of a city level, like Miles and I have mentioned, in reference to communications, the terminals that our call takers take are maintained and updated by the state of Massachusetts, and there seems to be no problems with that. They seem to be almost 100% reliable, except for that particular day. So I think this comes more to the city and investing into the infrastructure, the personnel, in bringing Boston EMS up to the 21st century. Many of us will love to see that. We'll like to see progression and not be always, like I said, forgotten on the waysides, trying to find whatever we can.
Okay, so we're going to be hitting the reset button on our capital planning and budgeting process again. So I think you've probably got a commitment for all of us here that we'll be certainly elevating this issue in the next budget cycle.
We appreciate that.
Thank you. Thank you, Mr. Chair.
Thank you, Councillor Braden. Councillor Weber, before we get to you, I'd just like to acknowledge CSO Aisha Lawton here with us, and she's here with her C6 youth leaders. So, folks, I'm very happy you guys are here. Just to give you a quick understanding of what's going on, today we're having a hearing regarding the modernization of the Boston EMS dispatch phone system. So we have here represented the union of the folks that are the EMS workers, as well as EMS themselves, the administration. And what we're here to make sure is that we've heard some arguments about there being not adequate equipment. And so we're hearing from the union on that and listening to the administration about what they're doing to solve that issue. And we are here to ask questions and how we can help support, advocate, and fund those improvements as we go along, just to catch you up as to where we are. But thank you so much for being involved, and I hope you continue to be so. Councilor Weber, you now have the floor.
Thank you very much. For the audience, my name is Ben Weber. I'm the City Councilor for District 6. I represent Jamaica Plain, West Roxbury, back in Mission Hill. So I have a question, I guess, to start with Superintendent Alexander. Does EMS have a wish list of what kinds of equipment they want? Do you have a plan in place?
I'm not aware of that. I don't know if my colleague Elliot Durdak might be able to answer that.
Well, what I can advise, as you already said, Superintendent, we have already funded and on order a new administrative phone system. It's a Verizon WebEx with Cisco equipment, which will be VoIP, similar to what the Boston Police Department has. And again, the radio system is under, as you had mentioned, multi-phase improvements to the neighborhood of about 20, since about 2020, and we replaced our consoles. All of that funding has been through the city rather than the Public Health Commission. And just bring a point that the CMED, or Central Medical Emergency Direction Network, which we manage and is totally funded by the region, which is the hospitals in the 61 cities and towns, including Boston. And we do receive annual compensation for, I believe it's 5 full-time EMTs up there to operate the CMed Center.
I guess, from the union's point of view, I mean, do you think the city is planning far enough ahead, or, what's your sort of reaction to, it seems like, we've got some things on order, but, is there a better way to approach this?
It seems like a lot of things have been on order, but we haven't physically seen them. Like I mentioned earlier, the CMed terminal was supposed to be updated years ago. It still hasn't, it's still not in function. The radios have been an ongoing issue for the last couple of years. Police and fire swiftly installed their new system as they were told to by the manufacturer and the service provider Verizon, and they did that without complications.
Okay, and then I guess for anyone, I mean, when it's on orders, are we waiting for Amazon to, put it in the truck, or, is not being manufactured? Or what does that mean, on order? Do you know?
As far as the administrative phone system, I've been involved since the end of June in twice weekly conferences with Verizon, and now Cisco's involved. And we have already received 15 phone set instruments that will be installed at dispatch operations, and that's the first phase. There will be more following for administrative offices in there rather than just the dispatch floor.
Okay, so in terms of advocacy, Councilor Braden was talking about what we can do, maybe getting things from the on-order column into the delivered column would be good. I guess my other question, sort of, we're dealing with this sort of two issues. One, having two separate systems, for basically for police and EMS, and that not being the same. The other one, I think, is there the state? Are they is it really the case that you can have a different system in each city, in each town? Like if I have a medical emergency, I have a better chance of surviving in, I don't know, like Attleboro than I do in New Bedford because the systems are different. Is there some state oversight there to make sure there's uniformity, or is it really just the case that it depends on what town you're in?
The 911 equipment, of course, is all state funded, and we at Boston EMS are a PSAP, shared PSAP with the Boston Police, where 911 calls are answered by a civilian police call taker, and if it is EMS related, the call is transferred immediately to one of our EMTs, and same holds true if it's fire related. In some other cities and towns, they have a single person that takes calls for all three of their respective agencies.
I guess for the panelists who are here, is there some state oversight, like to make sure that no matter where you are, you're going to get a response?
Oh, sure. There's a state 911 office that is responsible for not only the equipment, but for the training of the telecommunicators that operate the equipment, so that that is standardized throughout the Commonwealth.
Okay, and have they done an inspection of our system? And if so, when? I don't,
Since I don't have direct involvement with the next generation 911, I cannot answer that.
Okay, I don't know, superintendent.
I can't answer that either.
Okay, and I guess the other thing is, you know, what the difference between the sort of two sides here in the standard of equipment. I'm right to take from this that, you know, if you have a police issue, you're going to, at least the equipment is going to be more up to date. Is that right on that side than if you end up in EMS? There's not the same sort of like
The
connecting.
911, excuse me, Counsel, the 911 equipment is the same. It's just currently the administrative phones are different. But again, hopefully by early September, we will be operating on the same Verizon WebEx equipment that the police have for their administrative events throughout the city.
Okay, and I guess either for Elliot or the superintendent, so we're advocating to have the, you know, I mean, you watching the, you know, I'm a little older than most of my colleagues, a little younger than a couple of them, but, you know, I recognize those like push button old phones from when I, maybe graduated from college. We're not going to be having phones like, I mean, are you advocating, superintendent, to at least, you know, have that equipment be as modern as we have on the sort of police side?
Yes, as mentioned earlier, the phones are available. As far as installation, I'm not sure what the status or the situation is with that, but they are available. And it sounds like it was more of a Verizon switching system than anything else.
Yeah, yeah.
So
How do
in
you
theory,
see it?
like you were saying, Counselor, like Elliot was saying, if the calls come in, how in theory it should go through is through the 911 system, which is owned by the state and all the state terminals, then your survival rate, I would say, with our well-trained EMTs and paramedics, you would have a much better survival rate in Boston. However, if they go through a different channel and they have to be routed through one of the three, what we say primary lines, which is the direct lines to a supervisor, clerk, or a CMED, then there could be a delay or a mishap that could result in something. So I would, on the union stance, we would like to see all of our phones that are operated by anyone, EMT, supervisor, et cetera, have a 21st century phone that is the standard across all 911 communication centers in the United States, and that we can't use the communications as a reason for why someone has a delayed response or a poor outcome.
Okay, thank you. Thank you, Chair. I'm assuming I'm well
Nope.
beyond time.
Quite all right. Thank you, Council Weber. I'll just take the opportunity to ask a couple of quick questions myself. In taking my notes here, when we talk about multiple modes of communication, I had listed 5 that I believe you described, but I missed one of them. We have the 911 State Department. We have the dispatch, it brings along the details to the ambulance responders. There's one, Superintendent, you said, I think there's got a $20 million upgrade, or is in the middle of it. What was the name of that?
That's the radio system, so our personal portable radios, I believe the radios that are installed in the truck.
Okay, great. And that's different from CMED and so CMED and then the office telephones for the interoffice with the other
Correct.
2. So that's the 5. The difference between CMED and the radio systems, just so I understand?
So CMED is a system. We can use our portable radios to communicate with CMED, but also the external cities and towns, as well as us, can use CMED to contact the hospitals with priority calls.
Okay, so it's really just the system that's a larger switchboard for all ambulances, I guess.
To simplify,
easier
yes.
to simplify it. Simple's good here, right? So my second question, I think the answer, I said the EMTs in the ambulance, is the sufficient equipment enough? But I think those are the radio systems you're talking about then? That's going
Yes.
through the $20 million upgrade?
Yes.
And have we seen that yet? That's what folks have on them in the ambulances. I know you're more concerned about dispatch being the main concern, but I was thinking that what folks have on them while they are on the job and in the truck, have we seen that $20 million investment?
I think the union stance would be like, no.
Okay.
We have problems within the city where our portable radios do not transmit out, which causes a safety issue. There's been many years of us arguing that we need an upgrade, a better system, a more reliable system, one that's more suitable for this old type of city in its format in order for transmission, regardless if you're in Mattapan, Brighton, downtown, or in a high-rise or in below grade, that our radios work. They do not work in below grade in subways or in the tunnels all the time, where we would have to switch our portable radios over to Boston Fire, who has a more superior radio system.
So this comes down to, I mean, it's as simple as cell phone coverage, right?
Correct.
We have,
And that's our workaround, is if we can't transmit through our portable radio, which we're supposed to do by SOP, then we would have to use our cell phones, which is more reliable in order to communicate with dispatch operations, command staff, or anywhere else.
and important also because you yourself as an EMT might find yourself in a stressful situation, having to arrive at a scene where some, a chaotic occurrence may have happened and you yourself could be in trouble, and it's important to be able to radio for your own safety as well.
Correct.
Gotcha. Yes. Understood. So if we'd like to see that, I believe you said if you could see, sir, that the dispatch and CMed would be the one, out of those 5 lines of communication, those were the 2 you said you would prioritize, correct?
I think it would be the quickest and easiest to do.
The quickest
I
and
think
easiest.
most of the equipment is what we're told is here. We need to hire a company to properly install those systems in and get them up and working functionally as the manufacturer specs.
Thank you. That is a great lead into my final question, which is probably to maybe potentially to Elliot. This may be directed towards you, but in this installation, have you leaned on, work with, or sought advice from those at Local 2222 and the Verizon Union in how to engineer this, how the infrastructure may work, or even if it's procurement, coordination, installation, et cetera, and would they be available to help? Because I know in my discussions with the president of Local 2222 that they would be happy to do that. And so I want to make sure you are aware of that offer and that you will take them up on that as well.
As far as the administrative phone system replacement, which is in progress, again stated for a September go live, and where we do have equipment present, the holdup on that, and we're having twice weekly meetings, will be the WebEx or Cisco configuration of it on that. And as far as the radio system goes, we at Boston EMS Communications Engineering have not been advised of any dead areas within the city of Boston for portable radios on the street. Underground, and in some cases, a lot of cases, buildings, there's just too much blockage of signal that requires supplemental reinforcement, or what's commonly known as a bidirectional amplifier, a system that the fire department has implemented through hundreds of buildings over many years in Boston. And only last year, with changes to state building regulations, are we now part of it. And all new construction of anything over a 3-family, if they do not have adequate coverage for our radio channels, the builder must put in a system to improve coverage. Right, as of right now, we have 13 BDAs operating throughout the city in individual buildings. And any other building that undergoes a major, more than 50% remodeling also comes under that regulation. We do have coverage and have had coverage ever since the beginning of the Central Artery Tunnel, the I-90, I-83, Ted Williams, Cana, and Sumner tunnels. And we also have coverage, at least on 2 of our channels, in all of the MBTA stations, at least at the platform level. As far as going down into the tunnel, as Medic Junkins had stated, we have arrangements to use fire channel number 4, because their system does cover it between stations, or it's supposed to. We don't have that because normally we don't proceed into the track, down the tracks.
Thank you, Elliot. It would be my advice to the union, if you guys would write a memo, maybe to the superintendent and Elliot, to talk to boots on the ground and find out where you think those communication deserts are. If they're saying they don't have any identified, it might be good to say, here's where we have encountered that, so that they could look into those areas as well.
We can re-forward that.
Thank you. Yeah, that makes sense. So we will now go on to a second round of questions, albeit a slightly stricter time frame for my colleagues here. And we will once again start with Councilor Ed Flynn.
Yeah, thank you, Mr. Chair. And I want to also acknowledge and say thank you to Martin Sweeney and the men and women of 2222. They do an outstanding job as well. One of the most respected union leader, in my opinion, in the city of Boston, is a gentleman by the name of Miles Calvey, who I have tremendous respect for. But let me focus a little bit, or shift to the dispatch operations. But Superintendent, you're mostly focused on training, is that accurate?
Correct.
Okay, but there is a senior person that oversees dispatch operation that's a superintendent.
A newly appointed superintendent, yes.
Okay, and who is that person?
Superintendent Tom Finn.
Okay, and there is a superintendent of field operations, right?
That's the same person, correct.
Okay. Yeah, I was asking questions, but I was wondering why didn't we have maybe it's to the chair, the superintendent of dispatch operations would also have been able to provide some invaluable information as well. I know Superintendent Alexander did an outstanding job, but was the dispatch operation superintendent invited, Mr. Chair?
From my understanding, we started at the top with Chief Hooley, but scheduling and vacations for folks at this time played a major role in, filling this panel.
Okay, I understand. Some of my questions, I don't want to be repetitive and ask them again. So I'm going to focus on maybe to Jason. The role of a dispatcher is very stressful. You're dealing with medical conditions all day long, very emotional at times. What impact does that have on the person, on the dispatcher themselves, but also their mental health? Certainly you just can't end your shift and say, I'm fine with everything. That wears on you for a while, doesn't it?
It does. Our dispatchers, like I said, are multi-leveled. They're called they have to go through the training of all different aspects of dispatch operations. They become call takers, dispatchers, CMED operators, as well as they're still field EMTs, and they must maintain that certificate in order to maintain employment. So when they get into this line of work, they want to go out there and help people. It is a different realm when they go up to dispatch operations where they have to do it over the phone, so it's all virtual in nature. And they take a lot of that home. Like, they want to be out there, they want to help. And when they get those critical calls where the patients are in critical need and they're acute, they take it home, especially from a PD cardiac arrest all the way up to a traumatic event where someone's in a building that has collapsed and they can't get out and they have to talk to that person repeatedly until help gets there. They take that home. That takes a human toll on all of us. And it leads to, I would say, mental health as the root of it. We don't have enough resources in the union stance to combat that. We are healthcare professionals, but we don't have enough resources to actually take care of our own. So a lot of us, it can lead to negative consequences to the employees, and riddled that with other issues of underfunding, lack of respect, no confidence in leadership in some aspects. It takes a huge toll on our dispatch operations in particular, but the entire department itself.
Thank you, Jason. Jason, the work schedule, when someone shows up for work, traditionally an 8-hour shift, but are they working overtime, mandatory overtime, frequently? How does that work?
Yes. So we are in a better stance, I would say, comparison to several years ago. However, different divisions within the department are still understaffed, dispatch operations being one of them, where they can be forced to work an additional 8 hours in order to maintain minimum staffing. If minimum staffing cannot be done, then we go below par, which does occur frequently because of the inability to have a wide range of members who are trained to do that job up in the turret or dispatch operations. So they could go in, start their shift, expect to work 8 hours, expect to go home at the end of their shift, and then they're told a couple hours before, unfortunately, due to staffing needs, we're going to mandate you, we're going to force you to work an additional 8 hours of work.
Yeah, thank you. I knew that, and I know the Boston Police also experienced that as well. I think working consistently 16 hours a day is unhealthy for anyone. I think it's unhealthy for the family member as well. It's unhealthy for the residents of Boston. Could you imagine working 15 hours a day and then on the 15 hours straight, and then the next half hour you're dealing with a person that was just stabbed, and you're trying to provide comfort, or you're trying to provide medical expertise to that person and you're tired, and that's when mistakes can be made.
Correct. Many of our individuals work more than 40 hours a week in order to maintain the city levels because we care about our job, we care about our residents, we care about providing the best care we can. But when you work numerous hours, day after day after day, of course it's going to erode on the individual in their ability to perform at the highest level that we would expect.
No one's working more than 16 hours a day. Is that accurate?
The contract states they cannot work more than 16 hours.
Okay, good. The contract states that, but does it happen?
They can.
Yeah, I would like to know when that does happen. I don't want to see any city employee working more than 16 hours a day. Just for me, I need to know that, and I need to address it appropriately.
Many of us work that many hours in order to have a income in order to maintain a residence in the city of Boston.
So 17 hours, more than 17, 18 hours?
Some of us work enough hours in order to put a roof over their head, food on the table, and clothes for their kids.
Right. No, I understand. And I respect that, but at what point are you still on top of your game, providing the best expertise to the person that's needing care? You couldn't do that at 17, 18, 19 hours into a day, though. Is that accurate?
I think every individual is different. I think every person handles things differently, has different ability to cope with things depending on what's going on in their life. So I don't want to speak on everyone, but I would say for a majority, I think 16 hours is a good limit on anyone to work.
Yeah, I agree with you. When I was on active duty in the Persian Gulf and working a 16-hour shift in the middle of the night, carrying a sidearm, it's very, very unhealthy when you're sleep deprived.
Your adrenaline's always running. You're always thinking.
Yeah.
Your brain doesn't stop. Takes a toll.
And then you get some sleep for 8 hours, and you're back at it again.
You don't even get 8 hours. You have to factor in commute time from work to home, downtime.
Well, let me ask you from there, Jason. If you're working 18 hours, 16 hours a day, and then you're driving to your home, how good of a driver are you when you're on the road after working 16 hours a day, especially in a very stressful environment?
I don't want to answer that question.
No, I understand. I just want to, when I come to, I think everyone knows, when I come to meetings, I do everything I possibly can to support our city employees, and I don't like to see our city employees being put in a position where something negative can happen, and we need to support our city employees, but I don't think we're supporting our city employees when we put them into situations for possible failure.
We agree.
And let me add one more thing. Even if someone's working 18 hours a day, 19 hours a day, and you make a mistake, and I'm just speaking generally, this city is not going to support them. So if we're not going to support someone after 18, 19 hours a day, why are we putting that person in that position anyway? You make a mistake after 18 hours a day, and then the city suspends you for making a mistake.
Thank you, Councilman.
Yeah, I don't agree with it, but I'm frustrated with what is going on, but I just can't remain silent. Thank you, Council, and thank you for giving me an extra couple of minutes.
Thank you, Council Flynn. Council Murphy.
Thank you. So has the lack of investment in EMS dispatch infrastructure affected clinical outcomes for any callers in recent years?
I think you would have to take a deep dive and bring a company in to investigate that. Experience-wise, I would say any delay can have a negative outcome.
Through the chair, I would like to request all 911 calls that required EMT ambulance medical care that took more than 7 minutes to arrive for the last 12 months. So if we could get that from August 1st, 2024 through July 31st, 2025, could we actually, 6 minutes, 59 seconds, like right under their threshold would be good. And I know Councilor Flynn brought it up. We've had these tough conversations when we've been in this chamber advocating for our municipal police and other city workers who just rightfully, they just don't get paid enough. And the city, as we know, is so expensive, even for many of our newly created jobs in the city where people are making, $140,000, $160,000 a year. It's still hard for them to make ends meet. But could I also request through the chair, how often any EMT worker had to work, could we break it down more than 8 hours in the past year? And then anyone who was working more than 16 hours?
Yep.
Thank you. And I do just want to say, just in case I run out of time, thank you. Thank you all for being here. But Jason and Miles, the members are lucky to have you. You obviously know your work, and being a union leader, you're advocating, but you care, and you're one of them, and that's clear. So thank you for that. That comes through, and that matters because this work is hard, right? And my question was about, when we're putting our EMTs in situations where they're out in the field and they don't have the proper tools to do their job. But when that fails, it's not like if my laptop dies, then my laptop dies, right? The tools that I need to do my job aren't life or death, right? And it could result in harm to the EMTs, the city employees, but also those who you support and when you're working alongside the police and fire. So I just want to make sure that when we're thinking and talking about the need for this investment, that, these tools aren't just like fun gadgets. These are life-saving tools. And could you speak on the portable radios? Are they similar, comparable to what the police and fire use? Or even though we've invested in yours, are they still different from what police and fire have?
To my knowledge, the fire radios are a superior radio to the EMS radio that we have. They're two different models. I believe ours is the APX 7000, and I believe they have the APX 9000. Theirs has more capabilities, and I do know that there is a way to have an X, Y, and a Z axis on their radios. They don't use that, but there's a way to find that. Our radios don't have that at all.
Also, one thing I was mentioning to the chair, because of the structure and how police and fire fall under city, when we're in the budget conversations and we're at those, hundreds of hours of meetings with the different departments, we're able to ask those very specific questions to the police and to the fire. And many times, and I think all of us in this room have supported and advocated when we know, like, the fire needs new washing machines because they have to, clean off the cancer agents when they come in, and never mind investments in new stations and all, because that, I think, should be a standalone hearing. I've been to the Charlestown EMS station. Me and the rats were there, and, seeing what happens over at the airport with the East Boston. I know it was exciting at the groundbreaking. Thank you, Councilor Flynn and the South Boston electeds who have worked tirelessly to make sure that we have a fire, EMT station down at the South Boston waterfront. But, these are, needed investments, right? So it's the tools around your belt, it's the truck you're forced to sit in because you don't have a station to go to. It's also the calls, right? There's so many levels that you all deal with to make sure, because at the end of the day, we want to make sure, and we all care, that the residents, when they call 911, they get the best care. We live in, the best city. We have the best hospitals in the world. We have wonderful, one of them is here. Our community offices, our police offices are the best in the country. But if we're not able to step up and have the proper equipment needed to do the job that your members are more than trained to do, I think it's important that this body continues to advocate for that. So we'll continue to stay in touch to find out exactly, like, what specific asks and how do we, because it's not rocket science, we can figure it out. It's just a different way to make sure the funding gets there. And when there's political will, then things happen. So I think it's our job also to make sure that all of our colleagues are backing this need, because we've gotten it when we needed to support police funding, when we need to support veterans, seniors, fire funding. So it's important that we don't forget that our EMTs are oftentimes, unfortunately, I feel like out there, just kind of not really sure where they fit in. And I feel bad saying that, but it's just the way of the structure. And you do such, life-saving, just amazing work. So we need to make sure, or I need to make sure I step up and support any way I can. So thank you.
The union supports that. The men and women deserve it, so thank you on behalf of all of them.
Thank you, Councilor Murphy. Councilor Braden, you have the floor.
Thank you. I'm still trying to get my head around this. So we did have a procurement order to acquire a new, we have acquired the new 20 million upgrade to the radio system for EMS, but it's not, doesn't optimally perform in certain circumstances. That's one thing. So we did get it. But then, so the CMED used to contact that. The two deficit pieces are the CMED and dispatch, the antiquated phones that we have that are sort of from, I don't know, the ARC. Is it a procurement issue, or like when you have if you and I were going to get some renovations or some improvements done to our homes, you'd get a contractor and they would give you they would give you a contract, they would give you a price, they would give you some idea of when the deliverables would be delivered, and then you would have some sort of a guarantee in terms of follow-up service and maintaining, or some sort of a warranty on the product. Like, I'm just trying to get my head around how this all works. Like, why is it so difficult to? Is it that these systems haven't been appropriated and procured, or is where's the hold up?
It's a great question. That's why we're here. The union stance is that it should have been implemented years ago. When we finally do acquire this equipment, I would say it's going to be out of date, because as technology in year after year, it's going to change. So when it's finally acquired and installed, there's probably going to be something better, just like our portable radios. We've been asking for these phones for years. CMED console equipment is something that we've been told is just being held up that they can't actually get it to the city of Boston in order for it to be installed or go to the next step of installation. So that would have to be something that Lee Alexander would have to answer, of why there's been a lag of multiple years for CMed and for the main administration lines that are multi-use, why they still have not been installed.
So when you install a new system, you put out an RFP to say you're looking for vendors to provide a new system. Are there any consequences for failure to deliver if you've got if you've been given a contract to do something? Like, it seems like this is sort of a capital management issue, because this is capital equipment, like start, do, finish. Like, why are we not? Yeah, this is the $64,000 question, I think. But I think we have to get into the really nitty-gritty of where the problem is. Is it a procurement issue? Is it if the RFP doesn't have any particular target dates and times and costs? Like, as you say, it's an obsolete system by the time it gets put into place. It's not really helpful in this moment in time.
I'll defer to the superintendent to answer those questions.
Do you see where the problem is? Like, there's some sort of a process problem or a systems problem, that the things start, do, finish doesn't happen?
No, I agree with you, but I don't have the answer to that. I don't know if Elliot would have any more details as far as my understanding is the procurement has happened. As far as installation, I'm not well versed on that.
Well, the contract should include installation as well. So, yeah, so these are the sort of questions I'd love to get answers to, and follow up with the chair after this hearing to see if we can get some answers to these questions. I'd really appreciate it.
Absolutely.
Councillor, I can answer some of that for you. In terms of the radio system upgrade, that began in 2020 with replacement of all of our dispatch consoles at dispatch operations and our backup center, which is located at Boston Fire Alarm on the Fenway. The additional phases, it's a three-phase or four-phase system, consoles being the first, has begun, and we are in the ending stages of phase 2, which has incorporated change out of older infrastructure-related equipment on many of our channels, in addition adding a few more radio sites in the city. There's still more equipment to be replaced under phase 3, which will also add more sites. I must point out that portable radios that we're currently using in the APX series are public safety grade. They may not be the same as what our counterparts in the police and fire use, but public safety grade and have the features that we desire. But portable radios, other than when units of ours are in very close proximity to each other and are talking directly, have to run through the infrastructure network. And as I say, that's being improved. As far as CMed goes, the new console that has been funded by the region at no expense to the city or the Public Health Commission, I actually went to Canada on the unit. I wrote the RFP. This was before COVID. And on that visit to Canada, we discovered some problems that they were to work on correct. But unfortunately, COVID came in, and work on that stopped for a couple of years. We're now earnestly working to try to get the system online. We have the equipment in Boston. However, there's a software issue that we discovered, and we've been told by the vendor in Canada that they're going to work on that and should have a resolution by the third or fourth quarter of this year. You have any other questions?
No, I think, Mr. Chair, thank you for all my questions.
Thank you, Councillor Braden. Councillor Weber, you have the floor.
Thank you. Just a couple questions. So, I don't know, in terms of like location of the person calling, like, so can you just quickly, how do we determine that location if they can't tell us where they are? And is that impacted by, our ability to do that? Are any of these technologies that we're talking about go to that issue?
I can speak on historically. I'm not familiar with the current phone setup up there. Having been a call taker and dispatcher, the cell phone caller comes in, it gives a location in a general area. With the cell phone number, you're able to track. You always confirm the address with the caller. If you're unable to confirm, you continue to kind of ping that location, and it gives you a smaller area, so to speak. And I'm just speaking very general terms because it's been so long since I've been up there. And then that way, if you lose contact, you can call the caller back and get more information.
If it goes to the traditional way, or in theory, through the actual 911 state-owned terminals, then it would come and pin onto the computer screen for the call takers. If it goes through police or fire, they're transferred, and if it's transferred through one of these lines, administration lines where it commonly seems to be going through, then that technology, that information cannot be acquired.
Okay, and I imagine that would impact response times if you don't know where the person is exactly.
Depending on the call, if they are unable to, what the superintendent said, is give the exact location and verify it, then they're going to have to use other means in order to facilitate that.
Okay, and so in terms of what equipment we're talking about, that would, if we made some of the changes, that would eliminate, then the caller would have that location pinned.
We probably could eliminate that, yes, and they'll have all the advanced features that they should have, and when I mean advanced, be able to put out hold, transfer, and route the call to the appropriate terminal so that that information could be acquired accurately and effectively.
Okay, and I assume that location, that technology has improved, since the superintendent was on the calls. I don't know, location detection ability, whatever you want to call it. Yes.
There's better technology.
Okay, thanks. And then, Superintendent, last year EMS opened a station on Rivermore in West Roxbury. It's slightly off topic, but do you know has that improved response times in the area?
I can't speak to that. I don't have the call volume in front of me, but I believe, having that truck more centralized in West Roxbury, I'm sure helps.
Okay. And do you know, is it like in your opinion, is having stations like that, in sort of away from central locations like, Beth Israel or whatever, is that going to help response times if we have more locations like that, or is that part of your strategy anyway?
In my personal opinion, the more locations, the better. But again, I don't have the data to support that.
Okay, is that something the union is looking into?
We would like to see something more similar to the fire department where their response times are significantly better. So if we had more EMS stations throughout the city with adequate staffing and trucks, that we would be able to decrease our response times.
Okay, thank you, Chair.
Thank you, Councilor Weber. I believe, just double checking still. So no one has signed up for public testimony, so we'll forego that. And I would prefer to forego closing remarks unless anyone would like to have any last thing they would like to say or anything. It seems like an agreement here. I would like to thank the panel for coming, for being informative and educating us on both sides of this issue. And of course, we are always here happy to find a resolution of what's best for our citizens of the city. And thank you again to the C6 youth team here for being here and witnessing this. We really appreciate you guys coming along, and thank you, Aisha. The hearing on docket 1372 is now adjourned.
Thank you.